let's talk about treatment for amyloidosis. And as you can expect, the treatment will depend on what type of amyloid, right? So let's start with the light chain amyloidosis. So with this, you want to treat the plasma cells, so treat their multiple myeloma, right? And you can also use what we call bortezomib, which we're going to talk about in a second. You can also use cyclophosphamide, dexamethasone, and you can do stem cell transplants. What about serum-associated amyloidosis? So this one, you have to focus on treating the chronic inflammation. So treat the underlying chronic inflammation. If it's rheumatoid arthritis, treat the rheumatoid arthritis. If it's tuberculosis, treat the tuberculosis. If it's chronic osteomyelitis, treat the chronic osteomyelitis. Moving on to the hereditary TTR, we spoke about this earlier. So this one, you're going to use tafamidis, and this helps to stabilize the TTR protein. And of course, there are also new medication like gene silencing. So you can use things like patisiran or inotersen. And then moving on to the last one, which is dialysis-related amyloidosis. So with dialysis-related amyloidosis, your goal is to switch to high flux dialysis or transplant for those patients. And going back to bortezomib. So going back to bortezomib, which is proteasome inhibitor. So going back to bortezomib, bortezomib is proteasome inhibitor. So by inhibiting the proteasome, right, that will lead to accumulation of those misfolded protein. Remember, we mentioned the job of proteasome in the previous lecture, which is where we destroy protein that are ubiquitinated. So if you ubiquitinate any protein, that means they are destined for destruction in the proteasome. So by inhibiting this proteasome, that leads to accumulation of misfolded proteins. And because of this accumulation of misfolded protein, this is going to trigger apoptosis, right, by activating the intrinsic pathway. So this triggers endoplasmic reticulum stress, and that leads to apoptosis, especially in cells producing high amount of the protein, example like plasma cells. And there's something that is really important. This medication is associated with herpes zoster reactivation, and that's going to be a broad question. And in those patients, they need antiviral prophylaxis is recommended in those patients if they are going to take this medication.